Welcome to The Public's Health, the show that puts you, the public, into public health. I'm Dr. Tony Iton, your host and the director of the Alameda County Public Health Department. Well, we don't know much about the future, but we know one thing for sure. 2009 is going to be a year of change. Political, economic, environmental, climate. All of these things are certainly going to change this year, but some things will stay the same. The principles in health that we have to attend to make sure that our populations are healthy. This show is going to talk about some interesting controversies, one in chemicals and their contribution to perhaps disease, notably breast cancer, pandemic influenza, and finally, of course, we'll have some surprises for you. Stay tuned.
Hi, I'm Sherri Willis, Public Information Officer with the Alameda County Public Health Department. As you can imagine, during this swine flu outbreak, our health department is getting a lot of questions about safety, what precautions people should take, what information they should have in hand. Recently, I had the opportunity to talk to one of our physicians, Dr. Bob Benjamin. We posed some of those most frequently asked questions directly to Doctor. Why don't you tell us a little bit about the planning that has preceded this outbreak of swine flu in terms of the preparation public health has done?
Well, for years, Alameda County, all counties within the state and all states have been preparing for an event. The event that precipitated the planning was first 9/11, very honestly, and preparedness for biologic attack. Then that was followed by attempts to prepare for what appeared to be the possible emergence of an avian influenza.
Today we're going to be talking about a subject that is probably of great concern to you. It's certainly gotten a lot of media attention. Avian influenza, or bird flu.
So we've been planning for years about how to deal with an event just like this.
Please tell us, in the simplest terms, the difference between seasonal flu and swine flu.
Seasonal flu comes every year. Most of us who get infected develop an immunity to not only the seasonal flu that is circulating this year, but also the one before. We have a capacity to respond by developing antibodies. This one's different because apart from 1918, this swine, avian, and human mix of virus, no one has experienced it before and everyone is susceptible.
Tell me, what is a pandemic?
I guess the way to best describe it is we have an individual case, it transmits to one or two other people, that could be an outbreak. When outbreaks start to grow in magnitude and they encompass large numbers of people, it becomes an epidemic. It comes from the Greek, epi, upon, demos, the people. And when it spreads so widely that we're talking about global spread, it's pandemic, upon all of the people.
So talk a bit about the role of public health in a pandemic, such as what we're looking at now, swine flu. What is public health doing?
The role of public health in an epidemic or in a pandemic is basically simple. It's to prevent as much illness and death as possible and to prevent propagation or further spread of the pathogen.
We're joined now by Dr. Bob McCabe, an expert in infectious diseases. Welcome, Dr. McCabe.
Glad to be here. The flu bug is spread in what we call respiratory droplets. And these respiratory droplets are produced when we cough, sneeze, or even talk as we are doing now. So the name of the game is to not inhale respiratory droplets from someone who actually has the flu bug. The trick, however, is that those respiratory droplets may land on a doorknob or on a bedside stand, and you may put your hand on that bedside stand, and we all know what we do with our hands. They go to our mouth, they go to our nose, they even go to our eyes. Sure. So a key point in breaking the transmission of the flu virus from a patient or who may even be your coworker, for example, who may not even know he's infected because the flu virus is contagious before he even develops symptoms, is to prevent the virus from reaching your hand, or if it reaches your hands, to kill it. And the way you kill it is by hand washing.
Who is public health in communication with?
We've been in constant touch. It's from the top down and from the bottom up. CDC with the states with the local health departments with the providers and the public, and back the other way. We get feedback from the providers. We need this, we need that, this is what's happening. The Bay Area actually is in a very unique position in that there is an organization, ABAHO. It's the Association of Bay Area Health Officials, and they have, and it's the 9 or 10 counties within the San Francisco Bay Area, have been in daily conference calls. They follow immediately upon the state conference call. Communication has been vital, and it's been very, very effective.
And so when we do disease surveillance and control, what does that really mean?
Disease surveillance and control are pieces of the control mechanism. In order to know what, in this case, the virus is doing, we need adequate surveillance in place. This is communications with our hospitals, our providers, and the public to know who's getting ill, how severely ill they're getting, and what's happening on a day-to-day basis.
Yeah, most of our patients come from China, and we have a fairly significant population coming from Vietnam, as well as Korea and Cambodia and a lot of the Southeast Asian countries.
What kinds of things might a staff member be asking you as the medical director? What is my risk?
Yeah. Certainly we give them as much information as possible about the transmission and the types of patients who are coming in and what their clinical signs and symptoms might be. We also make sure that there are Kleenex boxes around, because something as simple as covering your cough or giving the patient who's in front of you a tissue will be helpful in decreasing transmission. What we also did was we bought the little Purell alcohol-based rubs, and we put them in each of the exam rooms as well as in all the front desk areas in order for staff to be able to wash their hands very quickly. We help to tighten up our triage protocols so that when patients are coming in, we could identify them right away and be able to engage a special protocol for them to come and avoid the waiting room.
Once we have a grip on that, we can then redesign, if necessary, the plans that we had in place for some other event to deal with this specific event.
What are we telling the public?
Basically what we're telling the public, and what government and all public health officials need to convey, is stay calm and be rational.
So tell us a little bit about some alternative approaches.
Well, the first thing that comes to mind is obviously walking.
Be reasonable.
Cycling as an alternate form of transportation can be a good choice for a lot of people who are trying to avoid a crowded situation, such as maybe sitting on BART or maybe sitting on AC Transit.
I take the BART a lot. I get on the BART sometimes during rush hour and it's crowded. There are people pressed up right against me. Sometimes people are coughing. Definitely I have to hold on to the hand railing. I'm concerned. During a pandemic, I might be putting myself at risk by getting into public transportation. What are some of the considerations that BART has taken to try to mitigate that risk?
Well, first of all, what we're trying to do is make BART cleaner, and that's regardless of whether there's a pandemic flu. The other thing we're going to do is offer our passengers a way to be able to improve their own hygiene.
The public has a responsibility, and that responsibility is to be prudent.
We have a free home delivery service. There's other forms of prescription delivery that work well also. Things like mail order pharmacy. Another innovation that's becoming popular in many urban communities especially is the drive-through pharmacy.
The prudent things to do are, if you're coughing, cover your cough. And I don't mean like this, because then you go and shake somebody's hand. I mean like this. That way, when you touch something with your hand, you don't transmit virus.
So I, as a resident of Alameda County, I want to know, what kind of powers does the public health director or health officer have?
The health officers of each county have the power to do whatever is necessary to contain the spread of communicable disease. And those powers are very, very broad and far-reaching. However, we, all of us in public health, have to be very, very cognizant of the impact of each and every action that we take. Perfect example is school closure.
This is an ongoing discussion, and it's a preliminary discussion because we're just starting in schools to think about these issues, thanks to you. There are healthy habits. Cough and sneeze into your elbow instead of into your hands. Wash your hands. We have to make sure that the schools have the supplies that they need in terms of soap and towels and tissues. Don't come to school sick. Don't send your child to school sick. And we need to give support to parents so that they understand that and that they don't starve to death in the process. I mean, we need to work on child care solutions as well.
What should the public know, particularly parents, about school closures, particularly as it relates to swine flu?
Initially, almost all public health departments which had confirmed cases followed the CDC's guidelines and recommended school closures. As we are learning more and more about how this virus behaves in our populations, we are backing off of that. The latest recommendation from the CDC is to back off on that. What we should be telling schools, what schools should be telling parents is no child or teacher should come in if they're ill.
Actually, in Oakland, we're very fortunate to have just passed a wellness policy, the point of which is to help to improve and maintain the health of our students across the board.
I mean, does it make a big difference to have that school nurse in the building?
We know from research that students who have school nurses are healthier in general. They are in school more. When they are ill, they're sent home, they get better health education because there's someone there to let them know this is how to wash your hands. There's someone to be checking on vital hygiene measures, such as checking out to make sure that the bathrooms are stocked and supplied, that there's soap, that there's paper towels, to make sure that whatever they're taught about hand washing, they can follow through with and feel that they can be successful in preventing the spread of disease.
Do I need a mask?
We're not advocating masks for the general public. Respirators are useful for healthcare workers, and these are specially designed. They're different from the masks that you might get for painting and otherwise. They have to be professionally fitted in order to work, and they are to protect people who are in very intimate contact with patients who are basically spewing huge numbers of virus to protect themselves. We are not recommending that for the general public.
Should I get a prescription for Tamiflu?
No, you shouldn't get a prescription for Tamiflu. This is something that your doctor, based on the severity of your illness, might recommend. But if people go and pressure all of the healthcare providers out there, I'm not leaving your office until you give me Tamiflu, there won't be any when we really need it.
What are we advising businesses to do? Is there something they should be aware of in terms of continuing their operations or protecting their employees?
Businesses by now should have developed continuity of operations plans.
BART also has to look at continuity of its operations when some significant portion of its staff may be out sick with pandemic flu. How have you looked at this situation?
We are looking at different plans whereby if a third of the staff goes out sick, what do we do and how do we maintain minimum operations, or if a fifth of the staff?
Well, a pandemic is a unique scenario in that it is going to affect a large geographic area. The fact that it is a pandemic, meaning it's a global event. That being said, when we look at our economy being a global economic economy, major corporations have interdependencies on vendors that may be in other countries. Well, a 30% reduction in your workforce is a critical impact to your ability to operate your business, for your ability to maintain your relationships with your customers. So we have to start to look at the planning in terms of interdependencies and how we would be able to maintain our business operations as we start to see this domino effect.
But really what we're asking is if employees are sick, allow them to work from home if that's possible.
We also are looking at ways of helping people work from home, setting up the IT infrastructure so that way people can log in from home and access their files from home, still get the work done, but not be around as many people in the building at BART, and reduce the chance of people getting sick.
Business can go on, but nobody who has high fever, who is coughing, who's got a runny nose, who is ill, should be coming into the workplace, should be coming into school. But that was the case before this. Now's the time to exercise that kind of prudence.
So lastly, what are our last thoughts, our summarizing thoughts that will make the public feel empowered and informed?
Bob, what do you have to say?
Thanks, Tony. The one thing that I think we absolutely need to reinforce is that influenza, be it pandemic or the annual variety, is spread by the respiratory route, and the single most important thing that each and every one of us can do is pay attention to our own personal hygiene. Cover our coughs, wash our hands frequently, and if you're sick, don't go to work because you'll give it to somebody else.
And now, another episode of Pandemic Detective.
My client wants to know when the flu pandemic will arrive. I don't know, but I don't guess. I get ready by examining the evidence. Meanwhile, don't forget to wash your hands and cover your cough.
Brought to you by the Alameda County Public Health Department.
I think it's outrageous that people are exposed to chemicals that they don't know about.
The issue here today is what's causing so much breast cancer.
There's a gray area of whether man-made chemicals are bad for you or any worse for you than what already exists in nature.
And in fact, there are many scientists who believe there is no connection between the environment and breast cancer.
We really need to do logical, rational investigations that are adequately controlled. And what we need to use is the scientific method, where you make observations, you correlate those observations with other outcomes, you formulate a hypothesis, you test that hypothesis, and you come up with a theory. And the value of the theory is in its ability to predict the future.
Every day, we have millions and millions of our cells actually experience mutations just because we live. Because our body temperature is 98 degrees and we breathe oxygen, then why do we get cancer so rarely? And that's because you have the cell and its neighborhood. And if you put the cell in a good neighborhood, even if you're a little half-cocked, you stay pretty good. But it's when that neighborhood changes that cell decides to be able to start walking about. It becomes cancer and becomes like a drug dealer. And so the challenge for us in the future is to be able to make the neighborhood good, and then the cancer will become much more normal.
So we think of ionizing radiation as a carcinogen. We know that from the Hiroshima-Nagasaki data that atomic bomb survivors have an increased risk of developing cancer over the course of their lifetimes. What we're interested in here is whether how radiation is actually acting, and we have good support that radiation can not only affect the target cells, the cells that will become cancer, but also this microenvironment, i.e. the neighborhood that Zena was just referring to. And that actually provides us a new perspective on radiation as a carcinogen, because it allows us now to kind of interrupt the process, to think about actually preventing cancer through the microenvironment.
There can sometimes be a disconnect between what scientific researchers are interested in pursuing scientifically, what questions they're interested in pursuing, and what questions the community is interested in having answered for their needs. One of the things that we do at the California Breast Cancer Research Program is to try to bridge that gap and have community groups and researchers together working to answer questions that are of interest to the community using the rigorous scientific methodology that scientists can bring to the table. One of those issues is the relationship between the environment and cancer.
In the field of community participatory research, you're usually talking about interventions where something is being done to the community to change something. And here we're talking about basically discovery science. So getting the community members to understand what we're trying to do as scientists and to translate that back to the community participants is a bit of a different challenge and one that we're really excited about. So this town hall is one of several ways that we have tried to do that.
14 countries and the European Union have already banned the use of phthalates for at least 10 years now. I think that really brought to light the fact that the United States is not doing enough, that we have become the dumping ground for a lot of the bad products here that other countries, even Mexico and Canada, don't want, but yet we allow here and allow our babies to be exposed to all of these toxic chemicals.
Some of these chemicals are useful for certain technologies. You know, cheap containers for beverages and foods. If we don't have these particular chemicals, we have to use something else. How do we know that the other thing that we're going to use is not going to be worse for us?
I think basically life is filled with the twists of genes and the quirks of our family backgrounds, which actually can influence things like when and if we get cancer. But to have chemicals in the environment, many of which we're not even aware of, possibly contributing to that condition, I think is an insult to people and to our health.
To find out what exposures are relevant to an increased risk of breast cancer, we need to start very early in life. So this particular conference and this research project is looking at exposures in young girls before they reach puberty, to see what's in their blood, what's in their urine, what they're eating, where they go to school, and so forth, to find out later on, you know, which of these little girls will grow up to have breast cancer.
Yeah, so there's a lot of issues faced by workers in nail salons. Many who are of Vietnamese descent are women who are recent immigrants. They are of reproductive age and tend to be of low socioeconomic status. And the products that they use on a daily basis, 8 to 10 hours a day, contain chemicals that are known to be cancer-causing and reproductively harmful.
One of the reports that we have is called The Falling Age of Puberty in U.S. Girls. We now know that girls are reaching puberty much earlier. It used to be age 8, 9, 10, and now it's happening even before age 8. And girls are getting breasts a full 2 years earlier than they did 20 years ago. So something is going on, probably a lot of somethings are going on in the environment, in our culture, that's causing this to happen. And early puberty is a risk factor for breast cancer.
All of us Americans, you out there, myself, everybody else is loaded with the doses of hazardous chemicals. We know that. We know that because our own Centers for Disease Control have tested numerous Americans across the country and have essentially concluded that all Americans have chemicals in their blood, many of which are very hazardous chemicals. So the question is, what do we do about that situation?
Asian Health Services, which currently manages the collaborative, is embarking on a breast cancer community-based research participatory project with the Northern California Cancer Center. And it's looking to see whether or not there is an increased incidence of breast cancer among nail salon workers due to their exposures, to their chronic exposures to these chemicals.
There are 80,000 different chemicals on the market, yet the United States Product Safety Commission does not do anything in my opinion, or enough to actually protect consumers, do the testing, do the research necessary.
How has an economy comparable to that of the United States responded to the same evidence about environmental health contributors to illness? And what I describe here in the book is basically how the EU has gone through a systematic analysis as to the potential dangers of chemicals in a whole array of consumer products and demanded they be removed. And that compares to the situation in the United States when we, faced with the same evidence, have actually done nothing.
I vow that if I got to the State Assembly, I would continue to pursue the looking at toxic chemicals and what it does to our young babies. 1108 is the result of that. It was a very tough fight. It seeks to ban the use of phthalates in baby products to be used for children under 3 years old.
And then when the research is completed, the community groups are just so much better than research scientists at getting the word out to the rest of the world and bringing that research to the attention of policymakers and being able to change public policy. Something that research scientists are always a little reticent to do. They want to be very objective and not show any partiality towards anything in the real world, really. So these partnerships are really important for advancing our knowledge and advancing the protection of public health in California.
What you can do is, number one, be aware of this, because I think being aware of the actual hard evidence that's emerging about the contribution of chemicals to health problems is step one. And secondly, to demand of your political leaders that they act on this information. And of course, you can make your own decisions as to what kind of products you want to buy in terms of that contain far less toxins than others.
Thanks again for watching our show. We welcome your comments. Feel free to call the number on the screen and give us your feedback of our show. And we hope that you'll tune in again. Thanks very much. Bye-bye.